you have heart valve calcification and you don't have a procedure to fix it, what's going to happen is you're eventually going to go into heart failure, where your heart is going to get so strong trying to move that leaflet out of the way that the muscle builds up so much that the chamber that holds the blood is almost gone. What we found is that the protein cadherin 11 appears in almost all cases of calcific valve disease that we've looked at. So we partnered to test an antibody, and through multiple tests that we've conducted, this antibody blocks the fibroblasts. It prevents them from becoming bone-like cells, which we see sometimes in valves. It prevents them from becoming inflammatory that we see in other times of valve disease. And ultimately, it prevents the leaflets from becoming thicker and stiffer and preserves the heart function. We believe that the cadherin 11 blocking antibody would probably be used as early as possible when you show signs of having valve disease to prevent the progression. We don't believe that it can reverse the process. It doesn't do that, because once you form calcification, that's like bone essentially. It's hard for any drug to get rid of that. But if we can prevent the process from starting at the early state of the disease, that's when we think that the drug would be really valuable. I believe that Roche is in phase 1 trials now for rheumatoid arthritis. So in 5 to 7 years, that could be on the market for humans, for human consumption with rheumatoid arthritis. Once it gets approval and we could do clinical trials for valve disease, it could be on the market a couple of years after that, presumably.